Hello, good evening, everyone. Welcome to today's talk organized by 365 Cancer Prevention Society and the Institute of Mental Health. I'm Emiko, your host for tonight. So I'll briefly run through the flow for tonight's session. We have Ms. Chanli Lin, who will be sharing with us about the topic on dealing with grief and new discoveries in our cancer journey. We'll also have a Q&A session at the end of the talk, so feel free to ask your questions at the comment section and we'll address them at the end of the talk. Do remember to like and share this Facebook Live with your friends and families, and also visit both of our social media sites for 365 Cancer Prevention Society, as well as the Institute of Mental Health. Kindly note that all information shared at this event by the speaker and 365 CPS are for general information only and subjected to changes. So do consult your doctor for personalized and detailed medical advice. So we have an ongoing campaign called Let's Fight Cancer Together to encourage cancer patients with lung, gynae, and colorectal cancer to seek consultation at Encore Care Cancer Center. The cost of the consultation will be donated to 365 CPS. And this campaign will be going on all the way until December. So the schedule for the respective cancers are shown on the screen. And if you want to find out more, you can visit our Facebook page or scan the QR code. So there are 3 talks part of this campaign. The talk on cancer was held on lung cancer was held on 2nd October. We have 2 more talks coming up on uterine cancer by Dr. Lim and another talk on colon cancer by Dr. So. So just to give you an introduction of our co-organizers for tonight's Facebook Live, the Institute of Mental Health. So IMH offers a multidisciplinary and comprehensive range of psychiatric, rehabilitative, and counseling services in both hospital and community-based settings to meet the needs of children, adolescents, and adults. IMH has become a recognized center for the clinical services, research, and education in psychiatric care. As a tertiary mental health institution, IMH actively seeks to widen its network of community alliances to provide a safety net in the community for those with mental health problems, and their partners play a critical role in the provision of mental health support in the community. So now we'll be inviting our main speaker, Ms. Chanli Lin, who is the Principal Medical Social Worker at the Institute of Mental Health. She's a qualified family therapist and has served patients and their families at the National University Hospital and also the National Cancer Center. So today she'll be sharing with us about the losses one experiences living with cancer, how it is linked to depressive symptoms, and its impact on the family. So without further ado, I'll now invite Leilin for her sharing. Hello, Leilin. Hello.
Hi, Miko.
Okay, so I'll now pass the time over to you.
Thank you, Miko. A very good evening to all of you out there. Thank you for joining me on this lovely Saturday afternoon. Let me now share my screen. Okay, let me say a little bit, set the context of my session with you this evening. My name is Leilin. You can call me Leilin, address me as Leilin on the chat session when we have some Q&A later on in the evening. I work in MH and I meet my clients for family therapy. I also do conduct training as part of my work, right? And in the past, I have worked with the National University Hospital and National Cancer Center. And I work with persons with various stages of their cancer journey. Some were newly diagnosed and seeking adjuvant treatment. Some were in remission and moving on with their lives. Some were in advanced cancer, but continued to find meaning in their living. And there were some who did not cope so well. My mother was diagnosed with third stage colon cancer in the early 80s. Those days, there was no chemo, no radiotherapy. My mom is here with me. She's 95. She's wheelchair bound with Alzheimer's disease. She still enjoys Cantonese opera on TV on her good days. Her eyes will brighten up if she sees her favorite opera star, Lam Ka-shing. Some of you might know who he was. As I'm talking, several bosom friends are in treatment, cancer treatment, or are in remission with cancer. Today, I'm very pleased to be invited to conduct this sharing on the topic, living with cancer, grief, and discoveries. I shall harness the rich learning and experiences from the cancer journeys of the people who shared them with me. And I'm always grateful for my clients for these life lessons, for they have taught me much personally as a social worker and family therapist. I appreciate that not all of you are cancer survivors. Some of you may be loved ones of cancer survivors or just interested individuals. I will be addressing the sharing to cancer survivors. For the rest of you, thanks for joining me today.
Hi, Leilin. Sorry,
Yes?
I think you can try to share your slides again because the slides are not up. Yeah.
I haven't moved. Can you see my first slide? Can you see my first slide?
Yeah, your screen is, we cannot see the slide yet. You want to try
You
to
haven't
share
seen the
again?
slides. Oh, okay.
Yeah.
Can you see my slides? Can you see my slides?
No.
Oh, okay.
Okay, we brought it up. Yeah, we got it up.
Oh, got it?
Okay, we try one more time. Yeah, just now it was
Okay.
up.
Oh, okay.
Yeah,
I'll try again.
yeah.
Is it up now? Can you see my screen?
Yeah, we can see your screen now. Thank you so
Okay,
much.
good. All right. Sorry
Okay.
about the hiccup. Yeah. Okay, so this is my first slide, and okay. Among you who are cancer survivors, I believe that when you were first given the diagnosis of cancer, events unfold very fast. You find yourselves overwhelmed by an often unfamiliar medicalized world of cancer. There is so much to understand, the medical jargon, different treatment options and procedures, building critical relationships with hospital staff, 101 appointments with which now take priority over everything else in your life. The urgent reorganization of work and everyday family life. All these leave you with very little or hardly any time or space to make sense and process any of what is happening. One of the most common experiences of being diagnosed with cancer is anger and helplessness. There is a sense of losing control. You find yourself disappearing, being alone in your anxiety. It is as if you have become the patient, and it seems like this is what you have become visible to the world around you. This can be profoundly destabilizing and frightening. You might have experienced others with their best intentions trying to influence you towards a varying number of treatments, herbal cure, diet, and lifestyle options. This can really be very confusing. You experience feelings ranging from disbelief, denial, despair, anxiety, anger, resentment, fear, depression, and isolation, and sometimes even suicidal thoughts. Having cancer can lead you to experience losses that are both real, practical, as well as existential ones. An illness like cancer brings with it multiple losses, concerns about finances and how much money you have to spend on your bills, the loss of a lifestyle prior to having cancer. While on treatment, cancer can have its impact on family life. You may temporarily or for some time not be able to provide the care that you used to give to your children. You wonder who will care for your elderly parents if you have been the caregiver. You wonder how you could manage the home chores and keep the family going. You wonder when you could have a good meal with your family without having to worry about what to eat and what not to. There is impact on work life and your career. You wonder if you could return to work and resume the position, the status, and earn the same income that you used to before cancer. There might also be the loss of dreams for the future. You wonder if you would be able to grow old with your spouse, your partner, whether you would be able to see your children marry and set up their own families. And there are questions about a lost identity and security. There is this sense of loss of physical integrity, this sense of, am I owning my own body? It is like others are taking over what you should be doing with your body. And there are questions about who am I now that all I seem to be is a patient? What about the other parts of me and my life? Who am I if my body changes radically? If I lose one or two breasts, if I lose my womb, all right, permanently. You will also be faced with questions about what cancer will do to the bridges in your life, your marriage, your relationships with your children, work, and other close social relationships. How do I talk to my partner, my parents, my children, my siblings, my friends about my cancer and my fears? Will I put burden on my family and make them worry for me? Will my spouse and partner still love me? What will happen to my children? How will I manage? What do I do about how I feel when I don't even have the words for my feelings? How do I have conversations about possible outcomes when what lies ahead may be so uncertain? If I'm cured now, will cancer come back? Will I die? Who would care for my children and my loved ones? Let us look at this quote from Miss Nurhana, a cancer survivor, reported in her World March 2021. She said, I sat my daughter down and explained what breast cancer was and reassured her that I would be fine. It was a tough conversation because she wanted to know if she would get breast cancer too when she was older. You don't need to tell the whole world that you have cancer. Having cancer can be a very private matter, but for most people, it is helpful that you find openness with your loved ones, a friend, or someone in your life. Share your thoughts and feelings with them. Cancer affects relationships. Communication can help reduce the anxiety and fear and the rift, the separation, the distance that cancer can cause. As in the case of Noharna, who has cancer, her quote emphasizes the need to manage the anxieties that children can have when their parents have cancer. The same goes for spouses and partners. I recall when my mother was diagnosed with stage 3 cancer in 1983. She had a major surgery. We did not tell her diagnosis. We never talked about it as a family. I believe she knows about it. I recall that the year following her surgery, I had recurring dreams. I was in my early 20s. I had recurring dreams of talking to her while she lay dying in bed. It was disturbing, and that was how I coped with the anxiety. But then I was already a grown-up. What if I had been only 10 years old? It would have been different. I thank my blessings now that my mom is 95, and at this age, I still have her with me. Talking about cancer with children. I used to work with parents in National Cancer Center who believe that the children don't understand and that there is no need to talk about cancer and how the children are being affected by the parents' illness. My sense is that many parents feel this way because they themselves are grappling with the acceptance of the cancer and its impact on their own lives. And of course, there are some people who really believe that children do not understand. Children and young persons know when their parents are sick, anxious, and worried. They also know when they are not permitted to ask questions or talk. When children are not given the permission to talk, what usually happens is that everybody in the family act like nothing has happened. This is despite that family routines have changed, the parent who is sick has stopped to work for hospital visits, and parents are talking less and acting awkwardly. Children are left to imagine the worst when they experience these changes at home. Not talking does not stop children from thinking about the changes and their concerns. Children can be told that their parent is sick and is in treatment, and for them to be able to express any fears and concerns they have. You have to give them permission to talk. They take the cue from you. You do this in a way that they can understand and provide the assurance that you are doing your best to seek treatment and to get well. But to do this, the adults have to first be able to process their grief and come to terms with their own illnesses, the losses, and find renewed meanings in their lives. And when you have difficulty doing this, you can do it with the help of a pastor, a religious person in your religious organization, or even a counselor. Talking about cancer with your loved ones, your partners, your spouses. Cancer can change one's body and one's self-image. Survivors are concerned about how this will affect their love relationships, their marriages, and how others see them. Your partner and spouse need to know what you are thinking and how you are feeling as you grapple with the losses. They need you to tell them how you want them to support you. When this is not talked about, they may try to care for you by overrunning your life, that is, they take over all decisions for you. Alternatively, they may stay away from you because they do not know how to connect with you. They talk less with you. Emotional and physical intimacy becomes adversely affected, leaving you feeling more alone and isolated. Family members want to support you, but they may not know what is going on in your life, and they dare not ask, fearing that you would be sad. They may also fear that they do not know how to respond when you are sad. It is okay to allow yourself to grieve, let your emotions out, and to allow yourself and your loved ones to grieve together. When grief is shared, it brings people together. And with support, everyone feels a sense of being in this together, despite the difficulties and uncertainties that lie ahead. The person who is ill feels understood and supported. The people who care for you feel a sense of being able to be useful to provide their love and care for you. Living with uncertainty in your cancer journey is never easy. It is important to remind yourself that fear and anxiety are normal parts of survivorship. Worrying about cancer coming back is usually most intense the first year after treatment. For some, they may find themselves in a cycle of worry as when the next doctor's visit is due, or when you begin to experience some ominous symptoms, a new lump or a new pain in the body, and when the doctor tells you that the cancer has returned. Here are some few ideas that I'd like to share with you to cope with the fear of reoccurrence. First, we need to recognize our emotions. Many people try to hide or ignore negative feelings like fear and anxiety. Ignoring and suppressing negative emotions only allows them to become stronger and even more overwhelming. It helps to talk about your fears with a trusted friend, a family member, or a counselor. Talking out loud about your concerns may help you figure out the reasons behind your fears. You can also try writing down your thoughts in a diary, a personal blog. Some people express themselves through writing poems, in art. These expressions can be very cathartic. Chronic suppression of negative emotions may lead you to have psychological distress in the longer run, or maybe even depression. 2, connect with your fears. Telling yourself not to worry or criticizing yourself for being afraid, for worrying too much, will not make these feelings go away. It is only human to acknowledge the fears and anxiety. Finding ways to manage these anxieties would be helpful. Finding someone who can connect and process those emotions with you can help a lot. A loved one, a counselor, a support group. Be aware that your anxiety may temporarily increase at specific times. This may include follow-up care appointments with the doctors, the anniversary of your diagnosis, when someone else has a cancer diagnosis. Sometimes what you're worrying about may be unlikely, so talking to a healthcare team may help you figure out if your fears are likely. 3, share your concerns. No one can tell you not to worry. When you have cancer, no one can tell you not to worry. But you don't have to worry alone. Sometimes you might feel that people who have not experienced cancer cannot fully understand how you are feeling. Many cancer survivors feel that their husbands, or even sometimes as counselors, my clients tell me that I will never be able to truly understand what they experience. And I totally agree, because as a counselor, I can only approximate their experience, but I can never totally understand their experience. But it will still help for you to talk to people, and maybe even people who go through the same situation as you. Many cancer survivors find joining a support group to be very helpful. Support groups offer the chance to share feelings and fears with others who understand. They also allow you to exchange practical information and helpful suggestions. The group experience often creates a sense of belonging that helps survivors feel less alone and better understood. Cancer can be very cruel, for it has the potential to assault one's body image. Survivors lose their sense of manhood or womanhood when they lose certain important body parts. They lose the hair during treatment, the discoloration of the skin after radiation, and the immense losing of weight. It can lead to survivors withdrawing into their own world to hide the stigma and the shame they feel. This can lead to more isolation and even depression. Confronting the body image, wrecking potential of cancer is not easy, but one can work through them by connecting with their loved ones, their spirituality, their fellow survivors, or seeking professional help. I like to make this quote by Miss Oh Mei Chi, a cancer survivor, in her World October 2020. She says, I used to think that body confidence is about what you wear and how you look, she says. But now I think body confidence can also mean portraying who you are as a person and what you are going through. Hence, body confidence is about owning all parts of who you are, your mind, your body, and your soul, and about owning your vulnerabilities and your strength. Some survivors withdraw from their loved ones, not wanting to be a burden. This may work for some, but it usually doesn't work for many. Often friends and families want to help. They may offer to run errands, provide transportation, prepare meals, and help you with household chores. Accept the grace of help. Accepting help gives those who care about you joy in the common humanity that you share. Allow others the opportunity to demonstrate their love and care. You don't need to be a hero. For unlike heroes in the movies, heroes who have cancer, who close themselves up, usually don't do so well. Also, encourage your family to accept help if it's needed. A cancer diagnosis affects the entire family, especially to the primary caregivers. Accepting help with meals or chores from neighbors or friends can go a long way in preventing caregiver burnout. Allow your siblings, your friends to bring your children out during the holidays when you do not feel up to it. Let's talk about cancer in the work environment. Someone with cancer has said, it was very awkward in office and sometimes difficult as my work colleagues didn't know how to treat me. They didn't know whether they should talk with me about my cancer or they were afraid to ask me how I was feeling. It is helpful to tell your colleagues your cancer experience, when are times when you don't feel so well, when are times you need their support, so that they know what to expect and how to come to you to give you the help. For example, if fatigue affects your moods or concentration, it gives them the opportunity to cover some of your work. And if you need some space, then they know how to stay away from you and give you that space. Maintaining an open and honest communication with your doctor and your treating team is an important part of your care. In fact, research has shown that people who have a good relationship with their doctor and treating team tend to be more satisfied with the care they receive. However, starting such conversations can be difficult. You can prepare notes before your doctor's consultation and surface them. Have your loved one or a close friend join you in these consultation sessions to help you understand the conversation. In your moments of anxiety, you may not have heard what you need to know or what kind of questions you need to ask. Having someone come with you helps you to have someone to check the information and bounce your ideas with before making decisions about treatment and care issues. Prognosis is a term for the predicted course of a disease. People commonly use the word to refer to an individual's life expectancy, how long the person is likely to live. However, prognosis can also refer to the chance that a disease can be cured and the outlook for functional recovery, which includes the prospects of being able to return to work, to engage in recreation, as well as the expected degree of help that will be necessary to accomplish activities of daily living. As Dr. Ira Byrok advises, there is no crystal balls and any estimates will just be educated guesses. Most people ask because they want to plan for the future. Hence, no two persons are alike. A statistical diagnosis is always just an estimate, not a firm prediction. Effective cancer treatments can sometimes dramatically improve a person's well-being and survival. Although knowing your prognosis can be helpful for making important personal plans, it is just one of the many factors to consider when you are striving to live fully with cancer. So while we hear the statistics, don't just hear the 50% who do not survive after 5 years. Do listen out to the other 50% who survive after 5 years. Okay. At NUS, where I used to work, a lady with breast cancer who had her cancer spread to the bones would almost always come to my office whenever she comes to see the doctor. She was living with bone metastasis for 5 years until I changed my workplace. I last saw her, she was still surviving and still able to walk to my office with all the pain that she suffered. Amidst the ongoing pain, her will to live was strong as she talked about how much she wanted to be present for her young children. When I worked at the National Cancer Center, one male patient I knew was given 6 months to live for his terminal liver cancer. He was still able to live quite independently when I last saw him 12 months into the diagnosis. This man found a lot of strength from his spiritual faith. You can choose what to focus on, to beat the statistics or to succumb to the more pessimistic statistics. What you choose goes a long way in how you live life with cancer. Studies have shown that persons with depression and anxiety have worse overall outcomes in all types of cancer in general and are at a higher risk of infection across the board. It is speculated that it has to do with cortisol. Cortisol is a certain kind of stress hormone, all right? The influence of anxiety and depression can raise these stress hormones and thus produce a relative immunocompromised state. I would now like to share with you the writing of Dr. Lichtenthal, a psychologist, who wrote the article Grief and/or Gratitude, Choosing Your Truth in Your Cancer Experience. She quoted the writings from the book Existential Psychotherapy by Dr. Irvin Yalom, a renowned psychotherapist. I shall share with you Dr. Lichtensthal's ideas. Beautiful undersea sea, right? Okay. Dr. Yalom wrote in his book, I was snorkeling alone in the warm, sunny, clear waters of a tropical lagoon and experienced, as I often do in the water, a deep sense of pleasure and coziness. I felt at home. The warmth of the water, the beauty of the coral bottom, the neon bright coral fish, the regal angelfish, the fleshy anemone fingers. And then, for reasons I have never understood, I had a sudden radical shift in perspective. I suddenly realized that none of my watery companions shared my cozy experience. The regal angelfish did not know that it was beautiful, the coral fish that they were brilliant, nor for that matter did the black needle urchins or the bottom debris, which I tried not to see, know of their ugliness. The at-homeness, the coziness, the smiling hour, the beauty, the beckoning, the comfort, none of these really existed. I had created the entire experience. The idea that we create our reality, that in our worlds, it can be true that there are both beautiful fish and ugly debris, and our experience depends on where we choose to look. This can be a provocative idea in the context of understanding cancer and loss. So which is true? Cancer brings loss, cancer brings grief, cancer brings fear. You are a victim, you are suffering. Or is this true? Cancer brings appreciation, cancer brings change, cancer brings connection. You are a survivor, you are resilient. Dr. Lichtenthal suggested that not all life's problems can be solved in practical ways. In fact, Many of the challenges cancer survivors face are managed by the way you choose to look at yourselves and the circumstances you are in. Hence, grief and discovery such as love, peace, and gratitude can coexist. She suggested that we give ourselves permission to experience the totality of what we are feeling. When you need to talk about anything that inspires you or bring you distress, capture the inspiration and the joy. Do it together. And when you feel the distress, stay with the discomfort, value it. You don't have to suppress it nor pretend that you're okay. Work it through with self-talk. Share it with your loved one or someone that you trust. Dr. Lichen Tol suggested that you are the creator of your truth. Allow me to add, you are the author of your own life story. I hope you can chew on this idea, which I find very inspiring. If you do not remember what I've just shared before, just remember the concept of self-compassion, which I shall summarize with you towards the end of this talk. Basically, self-compassion is a positive attitude that we can have towards ourselves. It is introduced into positive psychology by Kirsten Neff. It comprises 3 separate constructs: self-kindness, common humanity, and mindfulness. Having self-compassion means being able to relate to yourself in a way that's forgiving, accepting, and loving when situations might be less than optimal. How do we do self-compassion? Let's look at the 3 constructs. 1, self-kindness. Self-kindness is about showing kindness and understanding towards ourselves when we fail at something or when we are hurt. Sometimes in our moments of distress, we scream at our children, we shout at our spouse. Can we forgive ourselves? Rather than being critical or judging ourselves harshly when we're anxious and when we need help, we can recognize the negative influence of self-judgment and treat ourselves with warmth and patience and forgiveness instead. We do positive self-talk. We tell ourselves that it's okay to be angry, to be sad, but it does not make us unworthy. We forgive ourselves and we lose ourselves and shout at our spouse. We find ways to self-soothe. We pray, we slip it off, we meditate. We find ways to self-soothe in self-kindness. We get help when we feel the distress is too overwhelming for us. We accept our vulnerability. The second aspect of self-compassion is common humanity. Being part of something bigger is a pervasive concept in positive psychology literature. Maslow has long argued that the need for connections is part of human nature. Having common humanity means viewing our own individual experiences as embedded in the broader human experience rather than seeing ourselves as isolated or separate from others. Some people shut out others, their friends, their colleagues, and even their families, believing that they should carry their pain on their own and not trouble others. But our joining with others helps others learn about the trials and tribulations we go through. We help all of us to learn and grow together, our friends, our family. We all do this differently. Some of us are more careful who we invite into our world. Some of us are less open, but there is no right and wrong. In self-compassion, there is another construct called mindfulness. Mindfulness is seen as the opposite of avoidance or over-identification in self-compassion theory. It basically entails acknowledging and labeling our own thoughts as opposed to reacting to them. So when someone shouts at you, instead of shouting back, we ask ourselves, what is this shouting at me doing to me? What is this shouting at me making me feel? So when we are anxious or depressed, we usually unconsciously get drowned in our thoughts and emotions, and we become not mindful, and we become very reactive. And when we are reactive, we often say and do things that we often regret later. but being mindful or to be aware of our thoughts and emotions give us a better sense of control. It's basically like when somebody shouts at you, you stop. You don't react. You stop and ask yourself, what is this shouting doing to me? What is it making me feel? Right? You identify your feelings and your thoughts, and you think through before you respond. Okay. So sometimes in the midst of enjoying something that we are very happy, we may suddenly drift into thoughts of cancer occurrence and we get ourselves very, very anxious. There are two things that you can do. Number one, just let your body take over, let your heart calm, let the scary images calm, and let all the scary thoughts flood your mind and allow yourself to be frightened and helpless. Do you want to go that direction? Or do you want to take a deep breath? Be conscious of your heart beating faster. Let your mind connect with the change in your body. Let your mind connect with the beating of your heart. And not let the body run its own course. When you are aware of the increased heartbeat, you can do things to manage it. You can take more deep breaths. You can watch the parts of your body that's tensing up. You may want to decide to leave your seat and take a walk around the home, right, and do something different. There are a lot of mindfulness training programs in the country, and I urge you to try and attend this training because it is hard to learn to do mindfulness without training. All right, and you can practice them in your daily life. Parents fret, are upset when their children keep their problems to themselves. Parents ask their children to share their problems and be brave in times of adversity. The best way to teach our children to be resilient is for adults ourselves to be able to own our own vulnerabilities. By doing so, we face our frightening thoughts and emotions, we work through them. We will be in a better position to take control of our life situation, and our children will then learn from us. And I trust that with support and determination, one day you can become the beacon for your loved ones and fellow peers by how you choose to ride the waves of your cancer experience. This is my last slide. And in the end, I quote Abraham Lincoln, "It is not the years in your life that counts, it is the life in your years." With this, I thank you for your attention and would be pleased to hear comments and questions from you. Thank you. Over to you, Nicole.
Thank you, Leilin, for your insightful sharing, and I'm sure it has brought a lot of encouragement to those who are tuning in tonight. So we have now come to the question and answer segment, so feel free to ask your questions in the comment section. But maybe just to start, Leilin, there's a question, should I discuss my cancer with my children? How do I do so? Because I'm worried that I will make them worried and it may affect their studies.
Mm-hmm. I think first it's important to kind of like know the age of your children, all right? And the second most important thing is you need to find some acceptance about your own cancer condition. If you are struggling accepting your own cancer condition, it will be very hard for you to share that information with your kids in a calm and collected manner. If you were to share your cancer condition with your kids and you yourself are crying nonstop, it would only frighten them. So the adult need to work through your own grief, your own losses, and find your own meaning so that when you have to sit down and talk to your kids, you are able to do that in a calm, collected manner. It is okay for you to tear a little bit. It's okay for your eyes to be a bit watery. It is okay for even your teardrops to go down. But what's important is that despite the tears, you stay calm. You're able to tell your kids and assure them that mom is seeking treatment. Mom is working hard to get well. In the meantime, we'll continue to love you. And sometimes when I don't have enough time for you, I get daddy to spend more time with you, or I get Yi or Koko to come and spend more time. So it's important to give them the reassurance, but mom and dad needs to be very tight. You need to be calm and collected. But it is okay for you to drop a tear or two because that's you. It is okay for the kids to see you drop tears, but tell them that these tears are sadness, but it's okay, mom, it's all right. All right? I hope that answers your question. Yeah.
Thank you,
I
Leilin.
would.
Yeah.
I thought I might just want to add. It might also be helpful for you to do that with your partner, if he is also able to have that conversation together with the children. And you want to use the children's language. You pack your conversation at what they can understand. All right.
Yeah. So since you mentioned about doing it with your partner, so maybe just the next question, how might having cancer affect one's marriage? How will it affect your relationship with your spouse or your
Okay.
partner?
The many examples that I have are especially women who has breast cancer surgery, when they have one or two breasts being taken out during the mastectomy session. And you know the value of the woman's body, and how a lot of women, I mean, somehow there's this belief that, a woman's body is how attractive she is. So when this happens to women, it is very difficult for them to believe that their husband can look at the two scars on their chest and say, you are beautiful. Right? It takes a very mature man to be able to look at their wife without their breasts and to say, wife, I love you. All right? Because love is not just about the two breasts on the body. Love is more than the body of the woman. It is about that emotional intimacy that people can have, and you can also have physical and sexual intimacy without the breast, right? And some men may also, have when they go through chemotherapy, it can actually affect their libido and the ability to perform sexual intimacy, and it can make them feel really lousy about themselves. So couple needs to talk about the difficulty they are having during their sexual intimacy difficulties, rather than just turn away from each other in bed with one feeling disappointed and one feeling like, I'm useless. I can't satisfy my wife. All right. So couples need to look at themselves and say, there is more to our love, there's more to our relationship than what cancer has done to us. All right. So, and sometimes when couples can't do that by themselves, they might need a professional counselor, a family therapist, a couple therapist to work with them. But it's also possible that when couples are already not getting along in their relationship, that cancer can actually make the relationship can cause the couple to be even further apart. Because even without cancer, they were not talking, they were quarreling, they were fighting. So when cancer comes in, it can even make the relationship even more challenging to manage. So there's a lot to do for couples when cancer strikes one of them. Thanks for that lovely question. I think it's very important, and it's often a topic that people don't talk about. Yeah, and even women don't talk about that with their women friends, because they don't want to talk about their husband's problems with their peers. Right? As these are often very taboo subjects, but these are very important subjects that we need to talk about. If you have to go to a counselor, do this with a counselor.
Yeah. Yeah, so it's actually perfectly fine to seek help if you need to. Yeah, thank you so much, Leilin. Okay, so is it actually common for people to have depressive symptoms when they struggle to cope with cancer?
Okay, let me share with you what are depressive symptoms when people have major depressive disorder. Major depressive disorder is a clinical depression. It's a condition of depression where you need to go to see a psychiatrist. That's major clinical depression. Okay, and the symptoms of major depressive disorder are the following. You start to either sleep too much, or you don't sleep enough, you eat too much, or you don't eat enough. You start to feel very moody and very lousy. You feel very pessimistic about the world. You feel lousy about yourself. You feel unworthy. You feel useless. You might also feel suicidal. All right, and you have you have lost interest in even the things that you used to do, like karaoke or surfing on Facebook, the things that you used to be excited about, you have no more interest in. So these are the symptoms of depression. As I shared with you the symptoms of depression, do you realize that people who go through cancer treatment like chemotherapy also experience very similar symptoms? Like when you have cancer treatment, when you have chemotherapy, you will be puking, you can't eat, you also can't sleep because you're puking half the time. And because you're not well, you lose interest in watching TV, you don't feel like playing with your kids. You love to play with your kids, but you don't. You notice a lot of the symptoms in depression, major depression disorder, and in cancer, when you are receiving treatment for cancer and going through a lot of side effects are very similar. But if those symptoms are a result of you feeling unwell because of the treatment, if you are feeling unwell because of the side effect, that's not depression. And when when the side effects go away, you find yourself picking up, and then you can be happy with the kids, you can watch karaoke again, then that is not depression. All right. But when the chemotherapy, all the 12 cycles finish already, and then you continue to have those symptoms and although your physical body has picked up, you actually can eat, you stop puking, but you start to feel down, you feel lousy about yourself, and those symptoms continue to stay for more than 2 weeks and ongoing, then you probably want to see a psychologist or see a social worker or counselor for consultation. All right. So symptoms that are related to side effects of cancer treatment might look like major depressive disorder. But once those side effects are over and you still feel lousy, then you may want to talk to somebody. All right. So don't always assume that, when you go through those symptoms, it's because you're depression. Right? So you need to feel well enough, but yet you still feel lousy about yourself. You still feel like not wanting to live. You feel, and you are not able. One very important part about major depressive disorder is that you also can find that you cannot function. You lose interest in parenting your kids. You go to work and you can't focus anymore, and that is a very important part of major depressive disorder. You can't function in the things that you used to be able to do. All right. Thank you for that question.
Okay, thank you so much. So if you do find that you have these symptoms and they do last longer than 2 weeks or more, do remember that it's okay to you should seek help and get help if you need. Yeah. Okay. So feel free to continue to ask your questions in the comment section, and we'll bring them up during the Q&A. Okay. So for the next question, there is someone who say, what do you think about sharing that you have cancer with your colleagues?
Okay.
Oh, sorry.
Having cancer, having cancer is a very private matter. It is your right to decide who you want to share your cancer and what you go through with. All right. It is helpful for you. I think it's important for you to share with your supervisor, because your supervisor is the one who gives you work, assigns tasks to you. And for you to tell your supervisor when you need an MC and when you need to take 2 hours off because you're not feeling well. As for your colleagues, you probably also want to ask yourself, who are the colleagues who are kind and generous and are empathetic? And if there are those who are 三姑六婆带 and who can't keep their mouth shut, you probably want to decide that you want to keep away things from them. But you can let them know that, you have a condition, you have a medical condition, to tell them that you're having cancer, but you don't have to tell them too many things. Right? So you are the one who decide who you want to bring into your world, who you do not want it to bring to your world. All right. But it's important for you to have at least your supervisor or 1 or 2 closer friends among your office people who know what you are going through, so that you have people to support you. Right? But you don't have to tell the whole world if you don't want to do that. Right?
Thank you for your answer. Okay, we have another question. What if one cannot get away from the stigma of depression?
Okay. I think the stigma of mental illness is something that you can't get rid of. All right. Okay. But we are hoping that over time, more and more people in the society learns to be more empathetic towards people who have depression. Right? One way to deal with depression, the stigma of depression, or even the stigma of having cancer, is to be able to talk about it. The more you try to keep it a secret, the more you are hush-hush about it, the more you notice that you are actually stigmatizing depression, you are stigmatizing cancer. There's nothing wrong about having cancer. It is just a condition in your body. You haven't done any bad thing, to have cancer. All right, you didn't kill anybody to have cancer. So I think it is important for us to face cancer, to face depression, and confront it and tell ourselves it is a condition, it is an illness that I need to learn how to accept. And if people do not understand, then it's my job to help them to understand. Right? So, but if we can't even face it ourselves, then we also sometimes stigmatize ourselves, because in stigma, there are two types of stigma. One is social stigma. Other people stigmatize you. Another stigma is self-stigma. I have cancer, people with cancer, I cannot do much about myself. All right. So when you stigmatize yourself with depression, you stigmatize yourself with cancer, you bring yourself down. So you have to first be able to face your own cancer, face your own depression, for you to be able to face the world about your cancer, about your depression.
Thank you for your answer. Okay, so there's a question. I attended a talk when someone said that cancer was a wake-up call for her. So how can this be so? How can cancer be a wake-up call for someone?
Yes, I heard this many times over. I used to join the National Cancer Center when they do their yearly retreats with cancer patients and their families. And we used to do that in hotels, and we had lovely makan. And I used to kind of like facilitate groups with cancer survivors and their families. All right. And in those groups, I often hear people saying that cancer is a wake-up call. This is what they share with me. Cancer is a wake-up call, because before I had cancer, all I care about was my broker job. I only care about making sure that I earn as much commission as possible. I spend 16 hours in my office, and by the time I'm home, my wife and my children are asleep. But I take pride in being able to buy them a large condominium, drive a big car, and make them very comfortable. But when I have cancer, I realized that it was a wake-up call, because all these material things don't mean so much to me anymore. Yes, money is still important, but what is more important is my time with my children. I realized that I miss a lot of milestones that my children have. I miss my son's first time when he walked. I miss my son, when he joined. I didn't bring my son to kindergarten when he first went to kindergarten. I miss a lot of these milestones in my children's lives. Right? And cancer is a wake-up call, because I realized that money isn't everything. At the end of the day, it is love, it is family relationship, it is my connection with the bigger power, with my God. All right. So this is the kind of stories that I hear from people when they say cancer is a wake-up call for me. And as a facilitator running groups like this, I'm always very thankful, because they always remind me. I thank my blessings that I don't have cancer, but I thank my clients who share these with me to remind me that money isn't everything. I hope I've answered your question. Yeah.
Thank you, Leilin. So maybe for the last question, do you have any advice to give for caregivers?
Okay. Caregivers of cancer, I think the first thing is you need to read up, understand the cancer. All right. If you can, try and attend the consultation sessions with the doctors, so that you are able to be there to answer questions, to understand what is going on. Because when your spouse goes to the doctor's clinic, sometimes they're so anxious, they don't hear what they need to hear. All right. So you can go in there with them, you bounce ideas with them, you discuss treatment options with them. Remember, it is their body, so you don't want to overrun and tell them what you think is best for them. But you can suggest. At the end of the day, it is their body. right? You can discuss the pros and cons of going for the surgery, pros and cons of going for the chemotherapy, all right? But what is important is that caregivers need to also take care of yourself. And sometimes when you feel that sometimes when cancer patients go through chemotherapy, they can get, maybe it's a woman now, they can get quite manja, all right? And they can be very attention seeking, and they can very clingy, because cancer takes away this sense of control in their lives. And the only control in which this woman feel, or sometimes even men, is that their spouse is still with them. So they can become very whiny, or even men too. They can be very attention seeking. They ask for this food, or this not good enough, this is too saltish. And for caregivers, it can be very tiring. All right? So sometimes it's important for you to sometimes share your feelings with them, but not in an aggressive, angry manner, but to share your feelings about, when you shout at me, I feel really lousy. I appreciate if you could tell me how I could do differently, to talk about how you both can communicate in a very civil manner and allow each other to say sorry and to forgive each other. All right. And I think caregivers need to take care of yourself as much as possible. Talk to a church pastor, a mosque imam, a counselor if you need to. Talk to a good friend when you need to. All right. Because it can be very, very painful to see your loved ones suffering as well. And you need to sometimes deal with that pain as well. Thank you.
Okay, thank you so much for your answers, and this is all this is all the time we have for today's Q&A session. Thank you for your questions, and also a big thank you to Lilin for joining us today. Thank you.
Thank you, everyone.
So before we end, we like to share about an ongoing campaign called My First Memo. This is to encourage women who are 40 and above from low-income backgrounds to go for a mammogram screening free of charge. So this is important to help early detection of breast cancer. So you may show your support by donating via giving.sg. You can also scan the QR code to find out more about this campaign. And My First Memo is brought to you by 365 Cancer Prevention Society, Icon Cancer Center, and Satacom Health. Here you can also see our other community partners that are part of this campaign. So we will be having a Facebook Live Health Talk next Saturday, 30th October, 8 p.m. on Understanding Uterine Cancer and its Treatments by Dr. Lim Xiao Lei from Encore Care Cancer Center, and it will be held in English. And on the 13th of November, we have Dr. Thomas So, who will be sharing on preventing, detecting, and fighting colon cancer. So do mark these dates down on your calendars, and we hope to see you then. Do remember to like and share our social media platforms for both 365 Cancer Prevention Society as well as the Institute of Mental Health. And we also really appreciate and value your feedback from today's session. So please help us to fill up this form by scanning the QR code. We have also pinned the feedback link in our pinned comment, so you can actually use that link instead of scanning this QR code if you'd prefer. Our 365 CPS counseling team also offers professional psychological and emotional support to enhance the well-being of individuals, caregivers, and families. So if you require any support, you may set up an appointment with us via the link in the pinned comment of this Facebook Live. So we have now come to the end of our Facebook Live. Thank you all for tuning in tonight. We hope that it was an insightful session for all of you. So do stay safe and have a good evening. Goodbye.